talking with Dr. Mark Sloan, author of Birthday, and talk a little bit about, I guess it was kind of a controversy, I'm not sure if that's the right word, but dealing with painkillers given during birth, epidurals, is that good? And how has the science changed over the years as far as making birth easier for women?
That was one of the most interesting things in researching the book that I found and in fact what I thought was going to be a short little segment about epidurals became 2 chapters that I titled the section Pain and Politics, because pain relief for childbirth goes back to as far back as humans go, I'm sure, and attempts to make women more comfortable. But really starting in about the 1840s and 50s, when ether and chloroform were introduced for helping people both in surgery and in childbirth with pain, it's been a raging political controversy for 160, 170 years now, and the sides have sort of switched places over the years. Women at one point women who were pregnant were fighting to get heavy-duty pain medications, and then a generation later they're fighting to keep from being given heavy-duty pain medications. That kind of keeps going back and forth like that. Epidurals, they're very effective, but they have their own side effects. I talked about it in the book. You're more likely to have the woman having the baby is more likely to have a fever, or baby's a little more likely to have to be evaluated for infection for a lot of reasons. And also sometimes it can interfere with feeding. Those medications in the epidural go straight across the placenta to the baby, and sometimes that comes back to haunt you in terms of not real good breastfeeding right off the bat.
Do we know why pregnant women, some of them get things like hypertension or diabetes while they're pregnant? Is that something new, or has that always happened?
Well, it always happened. My mom had high blood pressure with me, and they had to induce me back in 1953. So even back then, they were worrying about it and aware of it. What's really happened in the last 20, 30 years is as the population has gotten heavier, those diseases have gotten a lot more common in pregnant women now. So it's whereas we used to not see a whole lot of mothers with diabetes coming in and having babies, it's a common thing now, and it's usually the adult type diabetes from being overweight. So it's a problem because the general health of women in the U.S. having babies is declining, just like the general health for the population in the 20, 30, 40-year-old range is not what it was 30, 40 years ago.
Isn't there, though, a gestational diabetes that you just get from being pregnant?
There is a gestational diabetes, yeah. That seems, oftentimes that predicts type 2 diabetes later on for a woman. But I'm talking about women with florid, regular old diabetes, type 2 or type 1. That's increased quite a bit, the type 2 especially. Yeah, but gestational diabetes has gone up because it probably is related somehow to type 2 diabetes.
And I know you talk about it in the book, and it is kind of interesting. Maybe you can give just a few seconds on the first 5 minutes of a newborn's life. Sometimes it comes out kind of misshapen, isn't it, the baby?
Yeah. They look like little prize fighters sometimes. If you want a nice, round-headed, photogenic, ready-to-go baby out right from the start, then you need a C-section because those kids look perfect. But once you go down the birth canal, you're kind of beat up there. But really, that first 5 minutes outside the womb, that is to me the most fascinating slice of life, in your entire life, because when you consider that a baby has to go from an all-liquid environment where they're not using their lungs at all, and within 5 minutes of birth they have to get the lungs cleared out. They literally change the flow of blood through the heart. And so a lot of things are going on that we just take for granted. We just figure, the baby's born, you dry him off, give him to mom, and off we go. But it really is remarkable to me how often that goes right. There's so many things that could go wrong. Rarely do they. So it's quite a system.
Well, what is the most critical point? Is it the first day or two, or is it a few weeks after for an infant to tell if they're in good shape or not?
Really, it's the first few hours after birth. And I mean, if there's a concern about the baby, as a pediatrician, I don't go to completely normal births. You don't need a pediatrician for those. But I go to births where there's a concern about the baby. So initially, the concern is, did the baby make that switch over from the way the heart works for a fetus to the way the heart needs to work and the lungs need to work for a baby? And that you'll know fairly soon, within a few minutes of birth. Then comes down, are there signs of infection? Are there congenital anomalies like heart disease that we don't see right off the bat? And those can show up in the first few days. But generally speaking, if you're looking pretty spiffy after the first day of life, you're doing okay.
Will babies breathe right away when they come out, or do you still have to give them a little hit on the bottom?
Now that's a cliche now. I've never spanked a baby on the bottom. But no, usually just, I think the big surprise of being born, it's so cold and wet and loud compared to what it was in the womb, is enough to get a kid yelling. But most of the time they start on their own. Occasionally we'll have to help a child with a little stimulation, just kind of rubbing them with a towel. And and then if that's not picking them up, then you give them a little oxygen, and most of the time they pick up and do fine. Usually if they're having a little difficulty at birth, it's usually because it was just kind of a rough birth. Something went on during labor that just kind of beat them up more than they were expecting, and they're having a hard time adjusting to the fact that they've got to do all this stuff on their own now.
For some of the women listening that may not have had children yet, is it I know it's never an easy process going through labor, but is it better now than it has been in the past as far as the medical end goes?
Yeah, well, medical end, I think, the technology is great when you need it. When you have a baby who's sick, or when you have a baby who's got an infection, I mean, or a premature baby, you really want the technology there. But technology has kind of intruded on normal births too, to a great degree. And I think that women who are thinking about, gee, what kind of birth do I want, need to really look into where they want to give birth, in the hospital or a birth center, or what setting they want to do that in. And it's not as regimented as it used to be, at least not certainly where I've worked. The women aren't expected to lay on their backs through the whole thing. They can get up and walk around, and the object is to make them as comfortable as possible, not necessarily to knock them out with medications, but just to honor their requests. If they really want to try to do this without pain medications, that's great, but to know that there are things there if they need them.
It is amazing when you think about it. Back in 200 or 300 years ago, how did anybody really survive when you think of it? If something went wrong, breech birth or something like that, it was almost luck if maybe, I guess that's why families had so many kids back then, because they kind of expected maybe one or two wouldn't make it. But nowadays with the technology, it's a lot better, right?
Yeah, infant mortality was really pretty high at various times in various places around the world history. The infant mortality isn't terribly high now, although, again, in the U.S. it's kind of, we tend to have more premature babies, and we don't do as well in some of those areas as other countries do. But overall, I think, except for places like sub-Saharan Africa and places where the medical care is just non-existent, a woman's chance of dying during birth, or a baby's chance of dying during birth, it's gotten extremely rare. As
a pediatrician and someone who's witnessed, you said, over 3,000 births, I guess it still must be a kick for you. I mean, it doesn't get old, does it, seeing that happen every time?
Sometimes at 3 in the morning it gets a little old. But every birth's a little bit different. I mean, I enjoy the kind of the family dynamics that go on in a room, and listening to people's stories and things. There's a lot that goes on around the birth as well. And it's always interesting to me. My presence there sometimes makes people nervous because they know I'm there because there might be a problem. But a lot of times, we can diffuse that just by chatting with people. So I do enjoy that part, and I still consider it just an amazing process, even after all these years.
It has to give you a positive feeling, I guess, to think when you see that, no matter what else happens the rest of your day, you see a new life come in the world. That must be kind of nice.
Yeah, and in my practice, what's been great for me is that I pick up a lot of my patients that I carry over the years from having met the parents in a pretty stressful time in the intensive care nursery or at a delivery that was going, worrisome. And every year, as I was just looking at the list of kids this year who are graduating from high school, who are leaving my practice and going on to adult medicine, and I can pick out the kids that I've known since they were little bitty babies in an isolette, or I had to do something with them to get them going, and that's a great feeling.
Well, the name of the book is Birth Day, and it really does give a fascinating look into what actually happens throughout the whole birth process. We've been talking with Dr. Mark Sloan, and did you have a website that people would want to go to?
Yeah, I do. It's Mark Sloan, MD, so it's Mark with a K and SLOAN, marksloanmd.com. And I had to put the MD in there so that people wouldn't confuse me with the Dr. Mark Sloan on Grey's Anatomy.
I was going to say, right?
That's been a bit of it's kind of hard to find me if you Google me sometimes. But it's marksloanmd.com, and there's a lengthy excerpt from the opening of the book there for people to take a look at.
Well, Doctor, we appreciate you talking to us for a few minutes here in Florida. When your next book comes out, we'd love to have you back on again. But thanks for being with us.
Great, I'd love to come back. Thanks, Doug. I really appreciate it.